The needs of patients at the dentist can range from improving a smile to solving a painful problem. Here to help is Dr. Diehl with Dupont Family Dentistry. Doctor, always good to see you. Tell me, what would you say to someone who doesn't necessarily like their smile?
Well, I would tell them not to give up hope on it, that there's always things that we can do to improve a person's smile. Whether it's going to be crowns and fillings or even dentures and implants, whatever it is, there's always options. There's always something we can do for you.
Any situations you've come across lately that kind of brought that home for you?
Well, over the whole career, that kind of stuff has been just ringing true to us. But, my favorite stories are like the grandmother that comes in and says, it's finally time for me to do something for myself. And my smile's not what it's been or what I've wanted it to be for a long time. And so they come in and we're able to help them with that and give them a new smile. It really brightens them up. That brings a lot of joy to us. But it's either from the grandmother or the hot dog sales guy at the Tin Cap Stadium. Just making a difference in people's smiles and giving them new hope in that smile is just something we really enjoy.
Yeah, it can change an entire outlook. What if someone doesn't have much time to do something like this?
Typically, most often what we do anymore is we get a patient sedated, get them to the place where they're pretty much asleep, in and out of sleep, and they come in and we just take care of it all in one day, in one appointment. Sometimes those appointments are 3 or 4 hours long, and sometimes they're 5 or 6 hours long. We try not to go much longer than that. And so we can get them, our goal is to get it done in the same day.
I'm sure there's someone at home that maybe doesn't like their smile, has been thinking about it, a little introverted. What's the first step that someone would take in order to go down this path?
First step is, reach out to the office, schedule an appointment, come in for a consult. Let us take a look around. Let's kind of get a game plan of what we can do for you or what your needs are. And meet someone. Her name's Cindy. She's our new patient coordinator. Come in and meet us. Let us get to know you, kind of establish that relationship, and just begin there. That's always the first stop.
And that, a new smile, that could really be a game changer, giving hope to people.
Absolutely. I'd like to think so. Again, what I commonly see is people have given up hope in their smile in some way. Over time, they've neglected it, life has happened, whatever the issues may be. But now they're at a point where they want to change that. And, and that's what we're here for, is just giving people new hope in their smile.
It's got to be tremendously satisfying, because once they're pleased, that smile's probably just out there all the time.
Yeah. So. It's so much fun. The best part is you take a picture of someone before we begin. We always ask them to smile. And you see these strains for a smile because they're used to covering their teeth.
Right.
And then you get done with it, and they get used to it, and they come back in, they see a smile, and it's a great smile, and it warms our hearts.
Makes a huge difference. Doctor, thank you so much for coming in. You can find out much more about Dupont Family Dentistry. Just call the number right there on your screen. You can see this interview again on Wayne.com. Just look under the Lifestyle tab, select Medical Minute.